Lesson 7F. Regulatory function of the kidneys using ADH. Urine excretion is an important homeostatic function of controlling water, electrolyte, and pH values. Peeing regulates your body's water, sodium, chloride, potassium, calcium, magnesium, phosphate, and hydrogen ion levels. This results in the volume and the composition of urine being different each time you urinate, depending on many factors, such as how much and what you drank, and how much of these materials have been excreted some other way. The control of the kidneys is managed through chemical hormones called Antidiuretic Hormone and aldosterone in concert with your nervous system. The main control center for water in the body, remember water is a major component of blood, is the hypothalamus of your brain. Low blood volume results in low blood pressure, as there is not enough water to keep the plasma volume at an adequate level. This will be detected by a section of your aortic arch and a stretch of your carotid artery, the pulsing blood vessel in your neck. These two major blood arteries have nervous tissue called baroreceptors, located here on the aorta, and a section of the carotid artery here called the carotid body. These two detect changes in blood pressure that vary from the normal pressure of 120 over 80 millimeters of mercury. If the blood pressure changes, possibly due to change in plasma volume, then an electrical nerve impulse is sent from the baroreceptors to the hypothalamus of the brain. If blood pressure is low, which is what these baroreceptors are best at detecting, then the hypothalamus in turn will send a signal to the posterior pituitary gland. The pituitary gland is a hormone-releasing gland found in the brain, composed of two different types of tissues, the front side or the anterior side and the back side or the posterior side. In this case of blood pressure, the posterior pituitary gland will release a hormone into the blood called Antidiuretic Hormone, also known as ADH. To remember this, it is often nicknamed anti-PP hormone, as it results in less pee. It does so by increasing the permeability of the distal convoluted tubule and of the collecting ducts to allow for more water to return to the blood, which reduces the volume of urine. There is less urine, but is more concentrated with ions and waste. Once blood volume and blood pressure increases, then the baroreceptors stop sending a signal to the hypothalamus. This in turn reduces ADH production by the posterior pituitary gland. With the lack of ADH hormone circulating, the permeability of the distal convoluted tubule and of the collecting ducts decrease, limiting water reabsorption. Less anti-PP hormone results in more urine volume, but would be less concentrated with waste materials. This up and down variation of blood pressure around the homeostatic value of blood pressure at 120 over 80 millimeters of mercury is managed by a negative feedback loop.